Hey everybody, welcome to Med School Radio. We are just looking at Anki, looking at custom study deck for reproduction. Elevated levels of HCG, for example, choriocarcinoma, may cause gynecomastia in males or hyperthyroidism due to homology between HCG and what? Between HCG and TSH, FSH, and LH. Next one. Lobules and small ducts of breast tissue are present in high density in the what quadrant? The upper outer quadrant. Male breast cancer is associated with what mutation and what syndrome? BRCA2 mutation and Klinefelter syndrome. What age group is associated with testicular germ cell tumors? Men 15 to 40 years of age. What are the risk factors for developing breast cancer, generally associated with increased what exposure? Estrogen exposure. The risk factors for developing breast cancer are generally associated with increasing estrogen exposure. Intraductal papilloma of the breast typically presents as a bloody nipple discharge in a pre-menopausal woman. Okay, so that's an example of Anki. Anki I find to be very helpful in studying for the STEP exams. I am currently at an urgent care getting a rapid COVID test. Very, very painful as usual. You know how it goes. Just waiting for the results, so I'm just looking at some Anki here. Okay, next one. Chronic endometritis is characterized by what and what in the endometrium? Chronic endometritis is characterized by lymphocytes and plasma cells in the endometrium. Lymphocytes are normally seen in the endometrium. Plasma cells are not. Okay, the following image represents invasive lobular carcinoma of the breast. You can't see the image, but it says that it's characterized by orderly row of cells due to lack of E-cadherin expression. What serum markers, and there are two, may be elevated in dysgerminoma? LDH. Oh, one second.
Okay, sir, so sorry about the wait.
Yep.
Your results came back negative, but
Okay.
if you have any symptoms or feel sick or anything like that for whatever reason, you can always come back to us and we'll take care of you, okay?
Okay, thank you very much.
You have a safe weekend, okay?
You too. Thanks very much. I appreciate it. Okay, so that's my results. Came back negative. So, what serum markers may be elevated in dysgerminoma? LDH and HCG. Okay, next one. Elevated levels of HCG, for example, choriocarcinoma, may cause gynecomastia or what due to homology between HCG and TSH, FSH, and LH. We just talked about this. Hyperthyroidism. I'll read that again. Elevated levels of HCG, for example, choriocarcinoma, may cause gynecomastia in males or hyperthyroidism due to homology between HCG and TSH, FSH, and LH. Okay. So thanks for joining me for a very quick session, just looking at Anki. Tune in again to Med School Radio. Thanks very much.